everybody. Welcome to Meddkit's Provider Spotlight, where every week we are coming here and interviewing the most amazing private practices from all over the United States. Every week we come here with a brand new perspective, learning new things, and people from all different specialties. So we're getting really great information and, something new to learn every single week. So I want to introduce you to an awesome special guest. I'm really excited to talk to you, Dr. Candice Escalea, owner of Prestige Ankle and Foot Care LLC. Welcome, Dr. Candice.
Thank you.
I'm so excited to get started, and I know we have a lot to dive into, but I think one way that maybe we can start off today is just hearing a little bit about your story. I would love to know what inspired you to open up your own practice and get into podiatry.
Okay, well, I guess I'm one of those kids that kind of always knew what they wanted to do in a sense. Since I was a little girl, I knew I wanted to be a doctor. I didn't know what kind, but I knew I wanted to be a doctor. So, I did everything you need to do, went to college. And then in college, it came down to time to apply for medical schools. Actually ended up getting a brochure in the mail. That's the odd thing. I got a brochure from a podiatry school, and I was like, I'm not really familiar with podiatry. So I kind of started to look into it, and I actually found a podiatrist. I was in New Orleans at the time. I found a podiatrist out that way and asked if I could come shadow them. She said yes. I came in, and I really like what she did. Just the aspect of being able to see people in the office. She did a lot of procedures. She did surgery in the hospital, and just the gratification as far as having people come in and walk in pain and they would leave feeling so much better. I just thought that was great. On top of the fact that she had a great home work life kind of balance, and I always wanted that for myself. So I just thought, hey, this sounds good. It's probably the thing for me. So that's how I kind of found out about podiatry, and so I pursued it.
That is amazing. And so, did you always have a private practice, or did you, work for someone else and then say, it's time. It's time to, let the, get out of the coop, let the wings
Mhm.
spread and fly. I am ready to start my own business.
Yes. So yes, I did. I worked for other people. I worked for it was a podiatry group when I initially came out of residency, and then I also worked for a larger managed care kind of organization. And I actually had helped the smaller podiatry group start new offices. And I was like, hey, so when I decided to kind of relocate to Georgia, where I am now, I said I should just start my own. I helped someone else do it. I know, kind of the ins and outs.
Yeah.
I know how I want to run it. I know how I want to serve the community. So I thought the best thing is let me go out and start my own practice so I can provide the care I think that people need.
Yeah, I think once you've been there and done that, you've seen how other people operate, you start like concocting your own like
Mhm.
Goldilocks approach to okay, like this is what I liked from here, this is what I like from
Mhm.
here, and this is how I want to serve now my community and my practice. And I think that's really great that you've had all that lead up time to open up something that really feels uniquely yourself
Yes.
and all of that. So that's amazing. I would love to hear a little bit about some of, the common areas that you treat, which I can imagine most people know, but I think there's a line of, okay, there's some common things that I treat, but also as a podiatrist, I'm sure there's a lot of uncommon things that you do help treat that maybe people aren't aware about and they don't know about. So I'd love to hear kind of your, common cases, but maybe some really uncommon things that you do that you're helping your community with.
Sure. So commonly, of course, most people know podiatry will deal with things like fungal toenails, maybe ingrown toenails. We deal with a ton of heel pain, plantar fasciitis, and just a lot of lower extremity pain and tendonitis. So those things are really common, I think, especially nowadays with the poorly made shoes that are out there, the different activities that we're doing in those poor shoes, and it tends to create issues with the feet. Now, something that's kind of maybe a little less commonly known, maybe would be things like some people don't realize we do wound care, especially in populations such as those with diabetes, vascular disease. I think a lot of patients don't realize that until they come in. They may have a wound and they think they have to go somewhere else. And I say, no, we can handle that here. That's definitely something we can deal with in house. And I think a lot of people may not realize all the time that we are surgical as well. So we deal with performing surgeries, not just bunions and hammer toes, but things again like amputations and those type of things as well.
Wow. Yeah, I think a lot of people don't realize that, especially with the wound care.
Mhm.
I think that, they might at first go to a wound care center at the hospital or something like that, but they don't realize that, yes, this all fa falls under the purview of what you do. And so I love that explanation. It's not just, fungal toenails and ingrown, toenails. Like there's so much more that meets the eye that creates, pain and suffering from the ankle and below,
Mhm.
right?
Yes. Yes.
Awesome, awesome. So what would you say, you talked a little bit about, you worked at some other places and you saw what they were doing and kind of made some changes that were uniquely yours and saw how you wanted to serve the community. But I'd love to hear a little bit more about how your approach is different from maybe some other folks that are around you or what you have adopted that you feel like makes, Prestige really special.
So my big thing is I always feel like you have to remember that the foot is connected to a body. So one, getting to know the patient, getting to know what their daily life is like, even understanding their total health history. I think a lot of people forget about that. They'll come in, they may say, well, why do I need to check my blood pressure at the podiatrist's office? Or, why do we need to take vitals here? Because your foot is connected to your body. So what's going on with your body affects your foot. What goes on with your foot affects your body. And so being able to get everything in line and try to get you to where we need you to be, we need to treat the whole person, not just localize our, focus on a foot or an ankle. So I think that's the biggest thing I'm trying to kind of take a holistic approach, essentially, making sure I'm very involved, being able to communicate with your primary care providers, other specialists that may be treating the patient, understanding how their daily activities go. If they're a person that's very active, doing a lot of sports versus someone who may be more sedentary, not moving around as much. All of that influences your treatment plan. And can influence your outcome as well. So I think knowing everything about that person instead of focusing strictly on maybe just what is happening with the foot or ankle definitely sets us apart. It allows us to provide a higher level of care.
Absolutely. And I love the communication part that you touched on there, as well as looking at the body holistically. Just because
Mhm.
you're just looking pretty much at the ankle and below doesn't mean that, you're not taking in account the entire person. And
Mhm.
I'm sure you've often find yourself, oh my gosh, maybe you've caught something, and the rest of the examination, like, oh, do you know your blood pressure is this high? Or
Mhm.
and other things like that that maybe your patient isn't aware of, but it's happening to them and affecting them in a certain way.
Yeah, definitely. We've had a lot of people come in, and we've diagnosed issues from, you know, findings we see on the foot and ankle. We've diagnosed, of course, diabetes. We've diagnosed vascular disease. And a lot of times I've even diagnosed things like heart disease and kidney disease because their lower extremities may swell. I'm like, look, we need to get you in. There's something else going on. This isn't strictly a lower extremity issue. This is a systemic issue. So we've been able to diagnose things like that. So people think it's just a foot thing and, if my foot is swollen or my ankle swollen, but it could be something going on further up in the body that is causing that symptom, but that's the first thing that they see.
Amazing that, it's crazy what the body can do, and
Mhm.
how it tries to cope with things. But yeah, there's so many ways where our body, I would say, shows symptoms and the way,
Right.
if it's something to do with your heart, you may not feel it in here, you may be
Yeah.
feeling it elsewhere before other, I would say, more common symptoms are present for you. So
Hmm.
it's great that you've been able to help people, through that process and maybe catch some things early for them so they can go and get help, which is great.
Right.
Yeah.
Yeah, definitely.
For sure. And, something that I do love talking about, which kind of goes in line with with some of this. I feel like we've been hitting on a lot of good misconceptions, but in this day and age, we have, Google, ChatGPT, all Gemini, all these tools to do research about our health. We used to
Hmm.
say like WebMD, but maybe people are still looking at WebMD. Maybe it's outdated. I
They
don't
might.
know. But I feel like, healthcare can be a confusing place, right?
Hmm.
There's a lot to learn, there's a lot to know, and there's a lot of, I would say, floating myths, old wives' tales that, still get thrown around a lot. And I'm sure you get a lot of that coming in, like, oh, like I thought if you do this, this is the right way to do this, or I heard this treatment is good, and blah, blah, blah. What are maybe some of the things that you hear commonly that are untrue about podiatry or a certain treatment? And you're like, man, I wish people would just know this once and for all. This is not true. So I would love to hear from you. What are maybe some of those things that you hear quite a bit?
Well, a couple of things. So one thing I've gotten quite a few times is, especially like with our diabetic patients,
Sure.
there are some that are scared to come into the podiatrist office. They feel that if they come in, they're going to get an amputation. And we're trying to, educate and let them know, no, we're here to help prevent that. But they're just, even though they don't have an open wound, they may not have a acute problem. They're just fearful because that's what they've always heard. They hear you go to the foot doctor, you're going to get, something cut off. And that's not true at all. Really, our goal is to salvage all limbs. So that's a last resort when someone does undergo an amputation. So that's a big one, as well as people feeling like podiatry is really only for the elderly or for people with severe foot deformities. A lot of people know their grandparents might have gone to podiatrists maybe to have their nails trimmed. And that's kind of the only thing that they really associate with podiatry. But we treat everyone. I've treated infants. I've treated up to 100 plus, as far as age goes. There's no limit to what age you have to be or that we typically see, because anybody can have a foot issue. So I think that's the big thing. You don't have to have major foot deformities to have foot pain. So a lot of people don't realize, hey, I should be seeing a podiatrist. My foot shouldn't normally hurt. A lot of people go with foot pain and just kind of deal with it, but they don't think that that's something that really needs to be addressed with actual physician.
That's really interesting. Yeah, I mean, pain is not normal, right?
Right. Yes. A lot of people make it normal though.
Yeah, I think, in our society we're fast moving, we're kind of like, oh, we'll deal with that later, and we just kind of move
Hmm.
on, suck it up, and lo and behold, then you got the brick coming through your window, like, ow, this is really bad now, and now could be in a worse state, kind of like what you were saying.
Hmm.
Maybe some of the diabetic patients that you have is that, hey, we're
Hmm.
trying to we're not here to cut anything off. We actually want you to have all of your toes. Like that would be
Right.
fantastic, So
Hmm.
we're gonna get you there, but the it seems like the longer you wait in certain things, the worse it is.
Definitely. And I see that a lot with, again, the diabetic population, those that may actually have wounds or ulcers. Sometimes they're fearful, which I understand. It's scary to have this open wound, to be diabetic and know what you've seen maybe your neighbor go through or your family member. But a lot of people wait. They try to deal with it at home, and they delay. And so it tends to make it a little bit harder for us. Sometimes it may be delayed to the point where we can no longer save that toe or that limb. So it's real important to really get those things looked at.
That's amazing advice. And speaking of some advice, I would love to leave off on some pro tips today from you, Dr. Candice. So I'd love to know what maybe there are a few tips or advice or common homework that you might give a patient, a client of yours. And then I'll kind of, this is kind of a two-pronged question, which I'll lead into the second one. Feel free to answer the first one first, but I'd also love to know some pro tips for other providers as, maybe they're starting their own practices, or maybe there's tips that you want to give to other providers that are not podiatrists, and what you might recommend to them, and what is important for them to know about podiatry, and for them to know about, hey, this is when you should refer a patient to us. this would be a really good candidate. So I would love to know all your pro tips.
Okay. Well, I'll start with the patients. So, as far as patients go, I always tell people again, don't ignore pain. I think that's the big thing. A lot of people have suffered for a long time before they get to us. They kind of just dealt with it. They thought it might go away. Maybe did little home remedies and nothing helped. But again, you shouldn't have pain. Pain is a sign that something is not right. So you want to get that looked at and definitely try to get it addressed as soon as possible. And don't ignore your feet. You know, a lot of people tend to deal with everything else. They'll even just simple things like moisturizing. They moisturize their whole body. They take care of their skin on their face, hair, all of that. But the foot is just like that's the least recognized or remembered place. And your feet carry you everywhere. I mean, you have to be on your feet your whole life. So if you don't take care of your feet in the beginning, they're not going to be able to take you to the end. So it's always important to remember your feet.
I love
Um,
that. That is such a great line. Like they're with you for the rest of your life. They carry you for the rest of your life. Treat them
mhm.
well. They're not going to take you to
Yes,
the end if you're not doing them justice. So
exactly, exactly. As far as providers maybe starting practices, I think the biggest thing, and something I was kind of told is make sure that you get good people who have expertise in areas that you may not be an expert in, that help you. Meaning things like billing, as well as things like your credentialing. A lot of people will try to do everything themselves because you're new. And I understand, you're new, you're just starting a business. You want to try to handle as much yourself as you can. But a lot of those things can cause long-term negative effects if you don't do it correctly the first time, especially credentialing and billing. So trying to get a good credentialing person, a good billing person, don't be worried about, maybe spending that extra money because it's really worth it, to just prevent those problems down the road. So I think that's a big thing.
I love
Uh,
that. Go ahead,
yes.
Dr. Candice.
Okay. And as far as when should they send a patient to us? Definitely for just general providers, any specialty, when you have patients that have foot pain and they've, already maybe done little normal type treatments at home, I think it's best to just go ahead and refer, honestly. To wait and let it linger, it just causes it to be a little bit harder issue to treat, honestly. So the quicker you can get them to a podiatrist, a specialist would be the best thing for them. Even with those patients that you identify as high risk, such as those with diabetes, those with neuropathy, those with circulation issues, those are big ones. You don't want to wait until there's a problem. Those patients are going to be high risk for foot problems, foot issues, and we really, really want to try to prevent. That's the biggest thing is prevention. So we don't want to wait until a problem begins to now refer. We want to get them there to a podiatrist so we can actually educate them and try to prevent them from ever having that issue, and going down that road where we're trying to save a limb, trying to save a toe. So I think the biggest thing is you see it, doesn't look right, you don't feel comfortable treating it, we're here. We're here to take care of it.
I love that. And like I think are a lot of ways that other providers can do a better job of sending to specialists, and just say, hey, this is what I might recommend, but I also recommend that you see this specialist and this that specializes in this specific area.
Right.
Like
Yes.
and know your boundary, know where you
Hmm.
might need someone to take that second look,
Yeah.
aside from yourself. So I think that's really great for everyone to hear, along with some of those, great tips, of you do always forget to like lotion your feet last. You
Yeah.
lotion your entire body and like why not, So now
Hmm.
I think everyone needs to take a mental note of that and recognize that you have your feet for the rest of your life. Treat them
Hmm.
well. I think that is something that really stuck with me and I think will resonate with everyone else. Now thinking about their poor life choices and shoes and, especially
Right.
girls with the high heels and all that
Hmm.
stuff, like you got to be wearing better stuff, right?
Right.
Well, Dr. Candice, this has been awesome. Before we leave off today, the last thing I'd like to leave folks with is if you can tell everyone where they can reach out, where they can find you, whether it's website, phone number, all the socials. So feel free to do any shout outs, for Prestige here.
Okay. Well, Prestige Ankle and Foot Care is located in Marietta, Georgia. Our phone number is 678-370-0970. You can go to our website. Our website is www.prestigeanklefoot.com. And we're on social media. I'm on Facebook, Prestige Ankle and Foot Care LLC, and on Instagram. And it's Prestige Ankle and spelled out AND Foot Care LLC on Instagram as well. So yes, we're online and we're here in Georgia to serve our community.
That is awesome. Thank you so much for being here today. And Dr. Candice, I hope to have you on again very, very soon.
Thank you so much for having me.
Anytime.